Another question I have is about the number of cases of the B1617, and how many of those that you know of already in BC are from community transmission, and how is that happening? Have you been able to pinpoint where they came from?
Yeah, so I talked about that a little bit today as well. These are people who are infected with the virus, and we treat every single one as if they are one of the more transmissible virus variants. The time it takes to do a screening test and then to do whole genome sequencing to identify the virus specifically is as long as a week and sometimes longer, and it has changed over the period of time. So we do know that there's been somewhere around 40-some people who have had COVID-19 that turns out to be one of these variants from the UK. When we link that data back with the public health follow-up that's done at the time that somebody's diagnosed, there's been a small proportion of them that we can say definitely came from international travel, primarily from India, but also from other places. So this strain of the virus is not only seen in India. And then there's a number of them where we cannot link it directly to, the vast majority of them have been linked to cases in the community. So it's not that easy to say exactly which variant is associated with which case investigation, because the case investigation happens at the time and we don't know until sometimes weeks later whether it's a variant or not. That's why we have gone to the weekly reporting of the proportion of our cases that are variants and looking for specific ones that may be of more concern. But the public health approach to every single case is assuming that they have these characteristics that we've associated with the variants of concern, which is increased transmissibility, and which is the most important one. And we are monitoring very carefully to make sure that there's no vaccine breakthrough associated with any specific variant.